Hello and welcome. If you're over 60, there's something you need to know, something that could save your life or the life of someone you love. When a stroke happens, the brain begins to lose oxygen, and brain cells start to die fast. But here's what most people don't realize. The first 5 minutes after a stroke are critical. In fact, those 5 minutes can determine whether a person walks again, talks again, or survives at all. Today, we're going to walk you through exactly what happens during those first few minutes of a stroke, and more importantly, what you should do as an older adult to respond quickly, calmly, and correctly. What exactly is a stroke? Let's start with the basics. A stroke is a medical emergency that occurs when the blood flow to part of the brain is blocked or a blood vessel bursts. Without blood, brain cells begin to die, some in as little as minutes. There are two main types: ischemic stroke, caused by a clot blocking blood flow, most common. Hemorrhagic stroke, caused by bleeding in the brain. Both are dangerous, but the earlier you act, the better the chances for recovery. Minute 1. Silent damage begins. In the first minute of a stroke, most people don't feel pain. That's why strokes are often called silent killers. But even without pain, brain cells are already dying. The person may suddenly feel confused, dizzy, or weak, especially on one side of the body. Some older adults report their arm feels heavy or their face feels off. This is the moment when every second counts. Minute 2 to 3. Visible symptoms appear. By minute 2 or 3, symptoms become more obvious. One side of the face may droop, speech becomes slurred or hard to understand. The person may not be able to lift one arm properly, some may lose balance or collapse. These symptoms are especially common in seniors because aging blood vessels are more fragile. If you see someone, especially a loved one over 60, with these signs, don't wait to see if it gets better. This is the time to act. Minute 4 to 5, damage accelerates. By minute 4 or 5, brain damage is speeding up. Millions of neurons are lost every minute without oxygen. At this point, the person may begin to lose consciousness or appear extremely disoriented. Sometimes, they may deny anything is wrong, especially common in older adults who are afraid of causing a fuss. Please don't ignore it. Don't wait. If you suspect a stroke, even a small one, call 911 immediately. Why time matters so much? Doctors have a saying, time is brain. That means the faster medical help arrives, the more brain function can be saved. Many stroke treatments, including a special clot-busting drug, only work if given within the first 3 to 4.5 hours. But here's the problem: most people don't recognize the signs or don't respond quickly enough. And for older adults, delays are even more dangerous because other health issues like high blood pressure, diabetes, or atrial fibrillation can make strokes more severe. Use the F.A.S.T test to spot a stroke. Here's a simple tool every senior and family member should know: F.A.S.T. Ask the person to smile. Does one side of the face droop? Arms. Ask them to raise both arms. Does one drift down? Speech. Ask them to say a simple sentence. Is it slurred or strange? Time. If you see any of these signs, call 911 immediately. Even if the symptoms fade after a few minutes, it could be a mini stroke, a warning that a full stroke may follow soon. What to do while you wait for help? 1. Call emergency services right away. Don't drive them yourself. To keep the person calm and still, don't give them food, water, or medicine. 3. Note the time symptoms began. Paramedics need this to decide treatment. 4. Loosen tight clothing and keep the room quiet and safe. And if you're the one experiencing symptoms, don't be afraid to speak up. Many seniors delay calling for help out of fear or pride. But remember, you are not a burden. Getting help quickly is not just brave, it's life-saving. A special word for seniors: if you're over 60, please take this seriously. As we age, our blood vessels narrow, and our risk of stroke increases. In fact, stroke is one of the leading causes of disability in older adults in the United States. But many strokes are survivable and even preventable when recognized early. Share this video with your partner, your neighbor, or your adult children. Make sure someone near you knows how to spot a stroke and what to do. Let's recap. The first 5 minutes of a stroke are critical. Symptoms often begin subtly, but become clear fast. Older adults are especially vulnerable. Acting fast can save your brain and your life. So the next time you feel something's off, weakness, slurred speech, confusion, don't ignore it. It's better to be safe than sorry. Thank you for taking the time to learn about your health. If you found this video helpful, please like, share, and subscribe. We're here each week with clear, conning, senior-friendly health videos because you deserve to age with strength, knowledge, and peace of mind. Until next time, stay safe and stay prepared.